Hello team, today we're going to go over the Community Outing Risk Assessment for all residents. We have been using this form since July of 2021, so this should look very familiar to you, but it's always good to have a refresher. I'll get a few definitions out of the way. Fully vaccinated refers to a person who is greater than or equal to 2 weeks following the receipt of the second dose in a 2-dose series, such as Pfizer or Moderna, or greater than 2 weeks following receipt of 1 dose of a single-dose vaccine, such as Johnson & Johnson. Prolonged contact is considered when a resident is within 6 feet for a cumulative total of 15 minutes over a 24-hour period with somebody who has known COVID-19. When a resident returns from a community outing, it's really important to ask them, are they vaccinated or are they not vaccinated? It's also important to know whether they're vaccinated or not, but sometimes if you're in a hurry, you might just need to ask the resident. If they are fully vaccinated and they did not have prolonged contact with a person who has COVID-19, then you would just say no here, and that would be considered a lower risk activity. If the person is not fully vaccinated, you're going to continue on to these questions. Also, if a resident answers yes to this question, you're going to continue on even if they're fully vaccinated. If this is a non-medical community activity, ask the resident if it was an indoor activity, if they were unable to maintain social distancing, if there were greater than 5 people at the activity. Check off if the duration of the activity was greater than 1 hour, or if they were unable to wear a mask during the entirety of the outing. All of the boxes they said yes to, and add the total score here. If it's a medical community activity, you'll assign 1 point to each of these questions, and you will ask the resident, were they unable to maintain social distancing from other patients and visitors at the appointment? Were there greater than 5 people in the common area? Was the duration of the appointment greater than 1 hour? Were infection control measures, such as hand hygiene, masking, etc., not in place at the medical site? And was there no screening of patients in place at the appointment site? Check off all of the boxes they said yes to and calculate the score. Now, if that resident was using dial-a-ride or some kind of transportation to the medical appointment, you would also ask these questions in the non-medical community activities for the duration of their transport. Once they get to the medical appointment, then you would calculate these questions. So you're still asking both non-medical and medical questions for residents during their transport. If they answer yes to 3 or more of these questions, that is considered a higher risk activity. If the resident had a high risk activity while they were outside of the community, they must be placed in quarantine for 14 days. This is very important because it could be the difference between having an outbreak in our community or just having a monitoring situation where just that one resident has COVID and we can take care of them and not spread it to residents or staff. I would also like to remind you to review this with the resident when they're about to leave for their community outing. If the resident knows what activities can possibly result in a higher risk and therefore a quarantine for 14 days when they come back to the community, they might make different choices when they're outside visiting with others. If you have any questions, please feel free to let me know at any time. And thank you all for everything you do to keep our residents and community safe.